Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Science proven knee exercises to strengthen muscles around the patella to avoid knee pain. Now this is but from the Journal of Orthopedic Sports Physical Therapy.
Right.
So it is science.
It is, and it's a well-researched study done for people who are active. So it really includes a lot of people that I think are going to be interested in it.
Yeah, if you got knee pain, you want to make sure you're strengthening in such a fashion that that knee pain is going to go away.
Not make it worse.
Not make it worse, right. If you irritate it, obviously, it's not going to help matters.
Right.
So
yeah, what
if
about
you are new to our
there
channel,
you
please
go.
take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also go to the Facebook and like us because Bob and Brad, right there we are. If you like us, we'll send positive vibes your way. They're coming at you right now, knocking you right off your seat.
Okay, so Bob, should we get right to it?
Let's get to it.
Let's go. Now, the study was done on weight-bearing exercises versus non-weight-bearing.
So they did both.
Right.
Okay.
And they gave us numbers of degrees of knee flexion to extension.
Okay.
So we're going to start with non-weight bearing.
All right.
And this is kind of interesting to me.
Am I going first, by the way?
Yeah, you go first. We're going to go resistance, and we're going to focus on the quadriceps.
Okay.
And that is the muscle that's connected to the kneecap, the patella, which it all relates.
So I have a cuff around my ankle, and I'm just going to go ahead and attach an exercise tubing here.
Not a rotator cuff, just a cuff. That was a joke.
Rotator cup. A lot of people call it
That's
that.
an inside joke.
Okay.
Yeah. Okay. So this is a non-weight bearing exercise. Obviously, there's no weight going through his leg.
Am I at a right angle?
Yeah. Now the study suggests, or the findings of the study are 90 degrees of knee flexion with variable resistance, which we have here. How's that feel, Bob?
Yeah, it feels good.
Yep. Now we're going to go to 45 degrees. Which is about halfway, because I know you don't have one of these at home, or you may.
So you're going from a right angle to about halfway between the right angle and the floor.
Precisely. And now, if I get real precise here, that would be right to there. So, but you don't have to get to the exact degree
No,
when you
so
do
you're just going to work
exercise.
it in this range right here.
Right. Non-weight bearing, resistive exercise. Now, this is one way to do it. I think it's a little awkward. You got to lay down and get things set up.
Right.
Be nicer to do it in a seated position. So we've got that option as well.
All right, why don't you show it seated, Brad?
So resistance with a band, you can vary by the color of the band. Usually the darker the band, the more the resistance. You're going to go
And sometimes we even double up the bands.
Yeah. Oh, yeah. There's a lot of different ways to vary the resistance on the bands. In seated position. Okay, I already got my
Cuff on?
But yeah, the cuff.
A lot of these sets for the exercise tubing come with a cuff, and they come with a handle, two handles.
Yeah.
So.
And now they even have them that some of them come with the anchor.
Sure.
What we have on the wall, which this is connected to, that works really well. So here we're going to be at 90 degrees, and I'm going to go out to 40. Again, non-weight bearing.
45.
45. Thank you. You know what happens when you get older, the memory thing at 40, 45, it all...
Yeah, it all sounds
good,
together.
Yeah, but good thing we're thinking science, because... So, and repetitions between 10 and 20. You're going to do it when it's pain-free in the knee, and this should be as it is.
And is that what they recommended, 10 to 20, or did you just come up with that?
Well, no, that's my recommendation
from basis.
from strengthening.
Sure, strengthening, yeah.
Okay, so this also is okay, but we've got a better option yet. It just happens to be a nice device out there, particularly for seated position, and you want knee range of motion. It really makes things stable. Just rest the leg on there. So we got a tiny little bit of weight going through the foot. As far as the knee, it would be considered non-weight bearing. And we're going to go here, and when you get out to about a normal range, we get to that 45 degrees.
Yeah.
So we're not going to go past the 90. We're not going to pull it underneath the chair like this. So you can adjust that. Just move the knee glide out.
So stay at a right angle.
Yep. So
and go to the 45.
when it comes to the end, we're at that 45. And there we go. Now this would just be if your knee was painful and it didn't tolerate any resistance yet.
Which we often recommend, by the way, is that you start off with movement. And movement is really good for the knee.
particularly if arthritic knee pain, if you have a knee replacement, we use these all the time for knee replacements. They work great. If you want to increase the quadricep strengthening, just like what we talked about for the study. Now this you can increase it by just going on an incline.
Right, now you're going uphill a little bit, and now it looks like really almost perfect, Brad. You're hitting 90 to 45.
Right.
You're hitting those angles without really having to work at it. I mean, it does the job for you.
You know, they should have had one of these knee glides on the study.
Yeah, they should have.
And actually, I can feel my quadriceps starting to exercise right now, and I've got a healthy knee. Now then, for more resistance, you can go with the band, connect it up to the anchor, and snap that on, and there we go. Now we've got the next step up.
Yeah.
Full resistance, and we could add another band onto there, or 3 of them, or
progressive,
or a darker color to get that right resistance that you're looking for. This is nice, Bob. This really.
No, this is I hope therapists all over the land have decided to watch this, because this will be a good thing for them to do in their clinics.
Right. There's nothing else like this out there.
Right. And you can do it at home too, obviously.
Right. It works very well.
So you want to do it with the ball too?
Weight bearing. Now let's go to weight bearing.
Sure.
Obviously, well, maybe not everyone's aware of it, but weight bearing means you're putting weight through your legs.
Sure.
Standing up. Bob, do you want to, shall we use the booyah?
The booyah?
Here, catch this one. There you go. Nice job. We didn't even practice that.
No, we didn't.
We did not practice. That was all luck.
All right, so what am I doing now, Brad?
Okay, now the study, instead of 90 to 45, we're going to start out. They found that if you start at 0, full extension, down.
With weight bearing.
With weight bearing,
Okay.
right, down to 45 degrees. So once again.
So we're not talking very far. And plus, I don't want the knee going past the foot, right?
Right, that's a good point.
So I'm not
Bob, that's what I like about you. You're always thinking on your feet. No pun intended.
So
we're going to
I don't want to go past that way. I want to dip down.
There you go. Keep that. And particularly with patella or knee pain, it's really critical.
So how close am I to the 45? That's about right there.
Come back up this way. Do. Right there's 45. I think you're going down more than you. Oh,
right about there.
No, too far.
That was too far?
Yep. There you go, right there.
Okay, so it's really not very much.
It's not very much, so really be cautious when you're doing your weight-bearing squats. Don't let the knee go past the vertical plumb line above the toe like we have here. I don't expect you to have, your wife or your children hold this, or in the gym.
No, but you're really going to do shallow squats is what you're doing.
You can see it.
And I've seen this before in other studies, actually, Brad, where, there's no stress on the meniscus.
Oh, right.
When you only dip down that far.
Right. So it's just not patella femoral spine, but
it
it's
would also,
meniscal.
also your cartilage, in other words. There's no stress on that. If you're even having trouble with cartilage, you can do these shallow squats.
And maybe I add one more thing, Bob. We could also incorporate good body mechanics by putting the stick vertical. And then not only do you minimize stress on your knee, but you minimize stress on your back, and it promotes good body posture with bending and lifting.
Right. Now, are you going to show the ball too or not?
Oh, absolutely. Always the ball. It's the beauty of the ball.
Sure.
But where's the ball? Oh, here it is. So if you do ball on the wall squats.
There we go. But the same thing with this. You don't want the knee. And that's what's nice about the ball. It's really easy not to have the knee go past the foot.
Right. To do that, you do have to step out a little bit.
Right.
Make sure you don't have slippery shoes or do it socks on a shiny floor, because your feet can slide out from
off
under
you go, and then you have another injury. It's tailbone injury.
Tailbone. We got video on that too, by the way. So where's my goni? Because it's not that far down. They're pretty shallow. Can you get?
So.
I think we want the other 45.
Oh, the other 45. Sorry.
There we go.
There we go.
That's a therapist comment.
There we go.
Makes you think with the. So we're going to go down.
Right about that.
Yeah.
That's about it.
It's not very deep.
Yep.
So you want to keep. It's shallow.
It's real shallow.
Right. And if you want to get more weight on here and you have no pain and you want to get more work with the quads, you could have some dumbbells in your hands. And work it that way. Again, we're not going to do 50 repetitions of this. It's probably 10, 20 at the most. I usually go 10 to 15. See how that works out with your
And my wife can
Knees.
testify to this because she was having trouble with her cartilage.
Sure.
And she could still do those shallow squats.
And
I
that's
still had her do those.
pain-free? Yeah.
Pain-free, right.
She listens to what you tell her.
She does when it gets really bad. When it gets, up to that point, I don't know anything. But once it gets really bad, then she's like, oh, maybe I should start listening to him.
Is it getting better?
It is much better.
So she's not going to need surgery.
No.
Oh,
no.
excellent.
She's real happy.
Bob,
yeah.
This must be big points for you then.
Yeah, I once in a while I get a few. So
All right, we can fix just about anything except for
our broken heart.
There you go. It
But
all
we're
fits
working on
together.
it.
It all fits
We're
together.
working on it. Thanks.